Renal failure cases are on the rise.
Kidney failure patients might not need to go under the knife.
Kidney disease is a major health issue, impacting nearly 800 million people globally.
Screened. More than 300,000 people here suffer from the silent killer of chronic kidney disease. And the organization warns that there could be even more undetected cases.
The challenge is that symptoms may not show up until 90% of the kidneys are already affected. Recognizing signs early, preferably in stage 1, is crucial. Let's explore these signs to help keep your kidneys healthy. Don't miss the last one. It could be a lifesaver. Swelling in the legs, ankles, and feet. When the kidneys aren't working well, they can't clean the blood properly. This means that fluids and waste stuff pile up in the body instead of being filtered out. Imagine standing in one place for a long time, and your legs start swelling. It's like that. When kidneys fail, they can't push out the fluids from your legs, leading to swelling in the legs, ankles, and feet. So, if you notice this swelling, it could suggest kidney trouble, but it's not a sure thing. It's essential to see a doctor to figure out what's really going on. Foam in urine. When your kidneys aren't working well, they may have trouble properly cleaning the blood, causing good things like proteins to end up in your urine. This can create bubbly and frothy urine, known as proteinuria. It's important to understand that foamy urine doesn't always indicate kidney failure. Other factors like a high urine flow rate can also make bubbles. However, if you observe foamy urine along with other signs such as fatigue, swelling, or changes in urination, it's a good idea to consult your doctor. For a more in-depth understanding, we have a dedicated video on this topic available on our channel. Feel free to check it out. Persistent bad breath. Various factors can contribute to bad breath, but ongoing bad breath could signal kidney failure. When the kidneys aren't working well, waste products and toxins accumulate in the bloodstream, producing an ammonia-like odor on the breath. Kidney failure also leads to an excess of urea, a compound produced by the liver and excreted by the kidneys, further contributing to the unpleasant smell. If attempts to freshen your breath with mints, gum, and brushing don't resolve the issue, it's advisable to consult with your doctor. Fatigue and weakness. Feeling tired and weak can happen when your kidneys, which are important for keeping your body healthy, aren't working well. The kidneys usually help get rid of waste and extra fluids, but if they're not doing their job, it can lead to harmful substances in your blood, making you feel exhausted. Also, kidney troubles can lower a hormone called erythropoietin, which helps make red blood cells. This can cause anemia, making you even more tired. It's essential to know that feeling tired or weak might be a sign of kidney issues, but it could also be from things like not getting enough sleep, not eating well, or just being a bit lazy. Before worrying too much about your kidneys, try getting good sleep and eating balanced meals. If you think you might have a kidney problem, it's smart to see a doctor for a checkup. High blood pressure. The kidneys act as the body's own control center for blood pressure. They produce hormones that help manage the balance of fluids and electrolytes affecting blood pressure. When the kidneys aren't working well, it's as if this control center has gone on strike. The hormones that usually keep blood pressure in check can't do their job, causing blood pressure to become uncontrolled. This rise in blood pressure can strain the kidneys even more and worsen the existing kidney issues. It's like a harmful cycle. High blood pressure makes the kidneys work harder, and this, in turn, causes the kidneys to malfunction, leading to a further increase in blood pressure. Shortness of breath. When the kidneys fail, it can cause difficulty breathing as toxins, such as urea, build up in the bloodstream, transforming into ammonia. This buildup leads to confusion, headaches, and shortness of breath. Additionally, kidney failure results in anemia, a condition where a shortage of red blood cells hinders the transport of oxygen to the body's tissues, causing shortness of breath, fatigue, and weakness. Furthermore, fluid retention caused by kidney failure results in the accumulation of fluid in the lungs, exacerbating the challenge of breathing. Lack of concentration. When the kidneys fail to operate effectively, a buildup of toxins and waste products occurs in the bloodstream. If these toxins persist, they can reach the brain, creating a situation similar to being in a room with a lingering, unpleasant smell that disrupts focus. The challenges in concentration arise from the presence of these toxins in the brain. Picture the kidneys as the body's custodians responsible for maintaining cleanliness. In the event of inefficient operation, the accumulation of waste affects various bodily functions, including brain function. If you're grappling with concentration issues, it's advisable to assess your kidney health by consulting a doctor to rule out any underlying concerns in the kidney area. When your kidneys are not working well, you might feel pain in your upper back, just below the rib cage, on either side of your spine. This pain can be steady or come and go, and it may come with other symptoms like fever, chills, nausea, and vomiting. If you're having this kind of pain and you think it might be connected to kidney issues, it's important to see a doctor. A qualified medical professional will check you thoroughly, ask about your symptoms, and do some tests to figure out what's causing the pain. This way, they can give you the right diagnosis and treatment. Difficulty sleeping. The kidneys help balance hormones, and if they aren't working well, it can mess up hormones like erythropoietin and renin, causing sleep problems. Kidney failure often means a buildup of waste like urea and creatinine, making it uncomfortable and tricky to sleep. A bit like trying to sleep with a really full bladder. Some people with kidney issues may also have sleep apnea, where breathing gets interrupted during sleep, making it hard to get a good night's rest. Nausea and vomiting. When the kidneys can't properly clean the blood, there's a buildup of waste products like urea, creatinine, and toxins, causing nausea and vomiting. It's similar to when you eat something spoiled and your stomach reacts by quickly expelling it. The same rapid exit happens with the stomach toxins being thrown out through the mouth. Kidney failure also disrupts the balance of electrolytes in the body, resulting in an upset stomach and vomiting. Itchy skin. When your kidneys are not working properly, they have trouble getting rid of waste and extra fluids from your blood. This can make harmful substances build up in your body, leading to an itchy feeling on your skin. This itchiness is called uremic pruritus. Also, when the kidneys aren't doing well, it messes up the balance of minerals in your body, which can make your skin dry and itchy. Frequent urination. When your kidneys aren't working well, they might have trouble managing the amount of water in your body. It's a bit like when you're on a long drive and you keep needing to find a restroom. When the kidneys aren't doing their job, your bladder is always looking for the next bathroom stop, making you feel like you have to pee more often. Kidney problems can also make you produce more urine or have difficulty holding it, adding to the need for frequent bathroom breaks. If you notice any of these signs, stay calm, but don't ignore them. It's better to be safe than sorry. Detecting and treating kidney failure early can stop more damage and make your overall life better. Our kidneys are super important for our body, so keeping them healthy is a big deal. If you have any concerns, talk to a doctor without hesitation. Do you find this information useful? Let us know in the comments. Subscribe for more videos and make sure to like and share. Stay healthy.